Hey guys, welcome to the Pre-Health Hub Pharmacy Q&A. It's not going to be too emotional like the pre-med Q&A because I have no emotional ties this time to the panelists, so that's good. But we're going to introduce Jasmine and Sarah. So pretty much, why don't you guys just introduce yourselves, such as like your name, your current occupation, a goal you may have, a funny fact, or like the best place to SIUE, you know? We'll start off easy.
I can go first, Jasmine. I know we're both trying not to go off mute there, but so my name is Sarah Surmeyer. I am a PGY1 pharmacy resident in Edina, Minnesota. Career goal right now is just to get a job, but long term, I would love to work as a clinical coordinator for cardiology specialty. Funny fact, I don't know if it's funny. I used to have ostriches as a kid growing up. That's my fun fact. I don't know if it's funny. Um, and and something. What do I miss? If I could go back to SIUE, the one food place I really miss right now would be Doc's Smokehouse because it sounds really good. Yeah.
Nice. I knew you were gonna talk about your ostriches. My name is Jasmine Rosales. I'm Justin's sister, if you haven't realized. My current occupation is that I'm a pharmacy manager for CVS Pharmacy inside the Schnucks grocery store markets right now in St. Louis, Missouri. Just got off of work, so a little tired. Um, a goal I have is just to see like where I have fast tracked I guess my career path, but just to see like what happens after manager, what else I can do. Since Sarah and I actually just graduated, so like we're still very new pharmacists. And thanks Ireland. um, Funny fact, I don't really have funny facts except it's not really funny, but a fun fact is that if you guys haven't noticed, Sarah and I are like best friends. So we're doing this together. Just, Justin, you're so mean. And best place to eat near SIUE. I miss Oriental Spoon. If any of you guys have ever gone there, that was my place to go. Took Justin and Sarah a lot, so thanks, Ireland. But yeah, that's it.
I have a husband, don't worry. One time we were in the kitchen dancing in the circle, and Jasmine fell into the garbage. That was like what, 10 years ago? Holy crap. Anyways, I thought there's your funny joke. But yeah, pretty much I don't have as much clarity for the pre-med one because I want to make sure that you guys have your questions too. Even though we are like smaller than the pre-med panel or the pre-med Q&A, like I feel like your questions would be like more specific and better questions probably because a lot of you guys are in the STEP program already. And you guys are probably gonna, I think a lot of you guys are going to pharmacy school next semester actually. I know Matthew, Paige, Greg, Luke, they're all going to pharmacy school next semester. So that's exciting. So if you guys have any questions you'd like me to ask at the end of it, we should probably have enough time to answer additional questions. Just DM me and I can put it in the end of the list as well. But without further ado, let's go on to the questions I've prepared beforehand. So, kind of answered the first part of the question already. What careers are you each in right now and where? So I don't think I really answered that one. But how did SIUE help get you to where you are today?
I can start again. So in complete honesty, I went through pharmacy school thinking I wouldn't do a residency. I didn't think I was good enough to do a residency. It's really a personal, like, I just didn't think it was for me. And being at SIUE, not until my APPEs, but specifically Dr. Berg, who's like one of my favorite people, who's an alum from SIUE, had put in my ear that like he really believed that I could do it and thought that the path that I would want for myself would go really far if I did a residency. So I went into applying for residencies thinking I wouldn't get one and just kind of shot in the dark. I ended up interviewing at a few programs and fell in love with the one I'm currently at. Now, all of that could have been cracked up to being at a different school. Maybe the same thing would have happened, but I like to think, oh, and I guess I should say, I met Dr. Burke in one of the classes we had at SIUE and took his rotation because of that class. So it all kind of fell into play. But I really think I love my program and I'm excited for what's going to come after my program. And not everyone can say that about residency, but I think the path I was on at SIUE definitely helped me get there and believe that I could actually do it. So yeah.
Okay. I didn't do residency. Definitely wasn't for me. I did think that I was going to do hospital when I started pharmacy school. And then we do like experiential like learning, like Sarah said. And it was my like first hospital experience ever. And like I grew up in a hospital, like my family's mostly like healthcare field, the medical field. So I thought that's where I was going to be. And so then I did my first ever hospital experience at St. Louis Children's Hospital. It was awesome. Like I loved the setting. I was impressed by everything, but I just like had a feeling I didn't like belong there. Not like belong, but just like I didn't want to do that in my future. So like that, those types of classes at SIUE help you like get the experience and like firsthand um, experience to see like what you want to do. So those are very, very important and helpful. And then, well, throughout like my schooling, I worked at Schnucks Pharmacy when it's still Schnucks before we converted to CVS. And it fit me. I like the fast-paced environment, and then learning everything we did in school, just applying it to whenever I got to work, like after class or something, like applying that really helped also. And then I also got my MBA, so my master's in business administration, and then that also just really helped me like basically get into this manager position also. And it also really was a great talking point, I think, in interviews when we started interviewing for jobs at the end of our like pharmacy school career. Yeah, I just basically followed the retail path like because I was doing it all through school, and then like everything I learned in school made me more confident in what I was doing, like and like prepared me to be a pharmacist in the retail setting. That's it.
You mentioned, I'm probably straying away from the script, but like you mentioned PharmD MBA. Is there anyone, I forget which of you guys were interested in it, but any of you guys interested in that? Yeah. So there you go. You have someone to talk to. My other sister, Jansen, who's not here right now, she also does business stuff as well, so you can talk to her. Anyways, let's go find out the next question. All right. So we have a lot of people here. They're about to enter pharmacy school next semester, or they're a first year who's also in the sub program. What do you think is the best thing for them to do right now as an undergraduate student?
Feeling really old thinking back to how long ago this was. I mean, I think honestly, like the best thing that carried me through pharmacy school was networking. I mean, you can study all you want, but the support system is really what it comes down to. I mean, even with Jasmine and I being best friends, there was a lot of really long nights studying for exams. So having those relationships built early really helped our P1 year. And I mean, there's going to be transfer students too, but I think the SIUE students who come into it already having those relationships kind of have a more of an advantage that you know so many people that can help with study materials and study sessions and things like that. And you might know some of the faculty, which I highly recommend in throughout pharmacy school, get to know your faculty because it'll help in school and then post school getting jobs. So if nothing else, find other pharmacy majors and just really get to know them because you'll spend a lot of time with them in 4 years. So that's my advice.
Completely agree with Sarah. Like that's probably one of the biggest things you want to do right now. But yeah, like being an undergrad, I feel like we didn't do too much to prepare. Like we did 2 years of undergrad, Sarah and I did. Um, and a lot of that was like fast tracked for us. Like Sarah and I took a dance class our last semester before pharmacy school, and we never thought that we were going to do that. Like we just fit it into our schedule because it's like just one last like fun brain like numbing thing that we could do. So like because we knew like it was going to be hard in pharmacy school, so we didn't want all of our undergrad to be just like super hard. Like we studied a lot in undergrad together. It definitely didn't compare to how we studied in pharmacy school. But yeah, like yes, I was in Orgo my first year, Justin. Thanks. um so yeah, that was very fast track. But like Sarah said, definitely um see how you study now, I think is also important because it could change in pharmacy school too. That like Sarah and I changed our study pattern like every year, I felt like, or like every class that we did. Just be like mindful of what you're doing and just don't be afraid to change how you study and how you approach things. Don't be afraid to ask other people for help also because it can get very overwhelming the material and what you're studying and that's probably another big important part of why Sarah says like network with like all your pharmacy friends now, and then even the people that you meet who are not from SIUE in your pharmacy school, because we met a lot of them and they really helped us through school.
All righty. Here's the next question. There it is. All right. Let's see. Okay, cool. This is for the kind of also pharmacy, pre-pharm people in the room, but also like we do have some other disciplines here watching us. Thank you, Edison, Ireland. But as a person working on the field, as you do, how important is healthcare collaboration, which is understanding the role of each healthcare provider and utilizing effective communication to care for patients? I'm going to copy and paste that on the chat so everyone can see it. Also, welcome, Michelle.
Well, I hate to keep starting on all these questions, but I am currently in my ICU rotation at residency, so I can really speak to this one. So every day we do rounding with providers, fellows, medical students, respiratory therapy, dietitians, just a lot of us going around on each patient. And I can say it's a lot easier when you work with people who are open to opinions and willing to chat even outside of rounds. Starting out, it was really hard for me to feel confident making recommendations to people that I don't can be kind of intimidated by and know nothing about, but like specifically our dietitian, I work very closely with on TPN regimens. So I made sure that we had a open communication on I could come to her and ask like, hey, I'm thinking the electrolytes look like this. Should we be adjusting that? And she eventually got to a place where she felt like she could ask me those same questions. So I think that's huge. And I've been on this rotation for 8 weeks, and the medical students, I will have new ones every 2 weeks. I can say it's a very big difference having medical students who are either afraid to come talk to pharmacy or don't want to talk to pharmacy versus students who, like this week, I have one student, his name's Luke, who will come every day and say, I don't understand these antibiotics. Do you have a recommendation? And I say, I'm not great on antibiotics, but like I know a few things, so we can work through it together. And then he feels more comfortable pitching it to the provider, and it helps me because it gets some of my interventions across. So I definitely think the interdiscipline, if you can get to know as many people as possible, it makes it very easy to make the changes that everyone pretty much wants to make. It's just got to communicate it against a bunch of different people working together. So yeah, it's something I'm continually working on, and definitely would encourage everyone to be open and talk to as many people as you can. So
I'm sorry, I keep making you go first, Sarah, but I knew this question was like perfect for you because you work in the hospital setting and you do a lot more of this than I do. I mean, I work in the retail setting and I do get to talk to like doctors and nurses like all day long whenever I have to call on prescriptions we get that like don't make sense. Or like today, we had like it was for a fungal infection and the medication was just too expensive for the patient and I wasn't able to get a hold of like the actual doctor. So I had to talk to another doctor who had to just like look at the notes for this patient and try to figure out like what we can do. But we ended up doing like some other antibiotic and another antifungal like cream that was way cheaper than $700 that the patient was going to pay. We put it down to $40. So like that was awesome. So yeah, like I talk to doctors like all day long whenever I have to ask questions on like things they send over to us. And like nurses and just whoever we get prescriptions from. And my technicians are also trained to do that also. So we all are just communicating together. So I feel like it's not too intense as Sarah's, but I do remember though, like when I was on my last year of pharmacy school rotations, I was on our internal med rotation, and I was at St. Elizabeth's Hospital, and my preceptor, she was like the she was a like clinical pharmacist, and we went on rounds with like doctors and like nurses and just like everyone, and she was a big like key component to that group because she helped them make a lot of the recommendations that like Sarah talks about to the doctors. And it was so cool to see like the doctors try to also, they kind of like relied on her on like specific medication information, because they say like pharmacists are your medication experts and stuff like that. And like I saw that in action, and it was intimidating for me because I didn't know a lot of the answers at the time. So but watching my pharmacist do it, she was just like rock star. And like the doctors were very helpful and like explaining like procedures and everything to us. So it was so cool, just like we all just sat in a circle and just talked about everything. So it's definitely a healthcare collaboration is definitely a big important thing. And like Sarah said, get to know as many like other healthcare professionals that you can, because they can be really really good like phone lines of one day. So
I think there's a follow-up chat, such as I don't know. I don't know if he's referencing Jasmine or Sarah, but like Matthew says, what do you mean by the prescriptions don't make sense?
yeah, so like if we get like a prescription for a medication that we usually know what the dose is, because like we've seen it multiple times, or they wrote like the directions wrong, and I just, because sometimes they send it over electronically and they don't probably mean what they wrote, and they probably just put whatever they thought was right, because I've had a lot of that happen before. But like that's just what we really mean, or like what they're treating is like raw or something like that. We'll try to call the doctor and see like, is this what you meant? Like just make sure.
Matthew says thank you. Michelle, I will
You're
put
welcome.
in the back. Just gonna go have questions, guys. We have a queue going on. It sounds like Q. Anyways, I'm gonna say give it an example of a time where you use healthcare collaboration, but we talked about that, so we won't do that. I'm gonna skip that question because I think there's a question someone asked. It's the same thing, but this is mostly a question I made up, but I think a lot of people might be curious about it too. But what is your response to the changing field of pharmacy? I hear a lot from the pharmacy students that the pharmacy in like 6 years is going to be a lot different than it is now. And a lot of these people are going to go into the pharmacy field in 6 or 5 years. So what would your response to be to that? Like,
Could you repeat the
Yeah.
question?
Can you repeat that?
am I pharmacy people? Am I saying this question right?
What?
It's like, you know, a lot of people say like if pharmacy is changing a lot, and how do you still be like kind of like a good like applicant, competitive in like in the future of like with the changing farms. And was that right, Butter?
Do you mean like post pharmacy, like applying for jobs or going into pharmacy school?
Post pharmacy school, yeah,
Just trying to get a job?
yeah, standing out because I think.
Oh,
Well,
man. Sarah's
yeah,
got a great answer for this.
Oh, we're
how
talking about
you?
like
Yeah,
what you can do during pharmacy school. I will get up
yes.
on my podium and preach what I said all through pharmacy school. You can have the best grades possible during pharmacy school, and I encourage you to be smart individuals. But if you don't do any networking or you don't do any volunteer work or any clubs, you will not be any different from anyone else that graduates. I would love everyone to join at least one organization and just give it your all because, I mean, job market, residency market, whatever you're looking at. I mean, I just went through looking at residency applicants, and anyone that pulls up, I don't care if you have a 4.0, that's great. It's like one thing. The other things I'm looking for are, did you work during school? Because if you work during school and your GPA isn't as great, well, I know you were working during school. You didn't have time to study. Did you bust your butt and get out there and network with people, go to conferences, organize volunteer events, or just go to volunteer events? Then I know you were busy and you were out there with the patient population. You were using your communication skills. You're going to be a well-rounded pharmacist. So just if you can take anything for heart, just like get out there and do something more than studying. Plus, it's way more fun to spend your weekend volunteering, or I guess working's not always fun, but you get experience, and that's invaluable experience. No matter what job you do, you will learn something from it, even if it's just the names of meds. So that's my soapbox.
I'm empowered. I'm gonna record that like little snippet and put on the Instagram. Just
I
want someone
told you
watching
Sarah
this.
had a great answer for this. She knew what to answer for sure. She also forgot to mention that she won a national video award for one of our organizations that we are part of. That's why we loved it so much. Like, it was a really good end of the goal before we had to go on to our clinical experiences. That was probably one of the highlights of pharmacy school for sure.
It'll be for a good fun fact in residency interviews. So
Oh yeah. It's awesome. It was Golden Girls theme, guys. You should try to find it on YouTube. It was great. It was so funny. But yeah, I mean, like that was the fun things we did in pharmacy school. Like Sarah said, like I got a lot of C's. I'm not even gonna lie. I got a lot of C's in pharmacy school. I was like an A-B student, like through high school, through undergrad. I was like, oh yeah, I'm gonna be in that honor society in pharmacy school. Yeah, I was nowhere near close to that, but it wasn't like discouraging at all. Like I like didn't try to overwhelm myself or stress myself too much. Like the stress was there, but I didn't want to like make it even more with how like with grades. Like that's a lot of pressure. And um thankfully we had organizations, and we also just had like we would do other fun things like that wasn't even related to school with our classmates just to like relieve stress. Like we'd all go play like sand volleyball. Like we played sand volleyball tournaments with our professors, and they were so scary good. Like it was so fun, but it was like so much fun because it was like it's like they gave you a test and you're like bringing out the anger of like through spiking a volleyball or something. But it's like that was a lot of fun. um but like Sarah said, like at the end of pharmacy school, you want your resume to look great. You want to stand out. What was that phrase that our old Dean Gupchup used to say?
A unicorn among zebras or horses or
Horses.
something. It was a unicorn. That's all I remember.
Yeah, he was like, he always told us to be unicorn among the horses. And like, it was always so cheesy, but like, it made sense. And like, I did what, like 3 interviews, I think, for my job. Like right now, like I interviewed with Walgreens, CVS, and Schnucks at the time. And I didn't realize how many good talking points I was going to have until like we made our resumes and I just started talking about my experiences throughout pharmacy school. It helped a lot to talk about myself. And I used to not interview like well, like at all. And like Sarah knew that. So and then like by the end of pharmacy school, once you do all these things, it really, really helps. But like Sarah said, whether you're in the like going to med school or pharmacy school, definitely make your like resume look good by joining organizations, trying to be on like the boards of those organizations to like help plan things. It really, really helps, and you make a lot of networking and friendships through all that.
Yeah, on top of that, just to add another point, like I said earlier, good to know your faculty, and organizations are a really good way to know your faculty. We know Dr. Kerr way too well, but I know if push came to shove, if I needed a reference, I would 100% use her, and I know she would talk me up for anything. So it is really important to get to know your faculty too.
Preach. Okay.
Oopsies, I was muted. Whoops. Okay. I mean, Ireland are having a little DM like or DM right now, and I'm like, oh my god, they keep on going. They're like, this is good. They're like, they keep going on top of each other, and Ireland is like, that's passion right there. So I thought it was funny, but yeah, I think a lot of you have heard this advice before already, too, from like your small group leaders or from the Q&A, and it does bleed through to pharmacy as well, and it bleeds through just in general as well. If there is any non-pre-med, non-pre-pharm people in the room right now. But actually, a lot of people don't know. I don't think Ireland even knows too, that Jasmine was actually a lot of like part of like the making Hub. Actually, remember Jasmine over the summer?
What?
Remember you were there when we P Hub together, pre-health hub.
Yeah.
You were there, and I asked you. Okay, well, never mind. I was. Well, yeah,
Maybe
Jasmine was.
I don't know.
When we made pre-health hub. It was the first exec meeting in like June, and
It
we
sounds
asked for.
familiar. Sounds familiar.
Yeah. Okay. We asked for advice on how like making more healthcare collaboration, why it's important. So
Oh yeah.
thank Jasmine for pre-health hub, everybody.
I
All right.
do think your guys' organization does a lot with like volunteer work and stuff. I follow your guys' Instagram because of Justin, but I do see you guys do a lot. So a lot of you guys, they're already on the right track. So that's awesome. You're welcome.
Matthew is actually one of our ambassadors right now too. We have small groups, and Matthew and Jesse's working actually as a pharmacy tech in the Walgreens or CVS in Glen Carbon. It's near that church, and near Wasabi too. Anyways, she's working right now, but she should be here as well. But that's why we're recording this. So Jesse, Matthew, they're both being like good leaders for the hub. So yay on them. Good job. You remind me of Jasmine, Matthew. All right.
It sounds like a good thing.
Don't compliment her. All right. So that's the questions I had. Now, these questions that you guys sent to me are pretty hard, and I'm not even ready to see what they're going to do. So we'll just, yeah. Good luck, Jasmine, Sarah. How does the School of Pharmacy allow for collaboration between different health disciplines while in school? And I can copy and paste that for everyone to see as well.
I'll go first so Sarah doesn't have to go first again. How does our school? Yeah, so our very first year of pharmacy school, we actually worked with dental students. Didn't know we were going to do that. It was our health ethics class, I think. Just learning the ethics of like the health field and stuff, like if something went wrong or like how to deal with that. But we worked with the dental students our first year, and then Sarah helped me out. Was it like nurses and where we had to like
We went to Springfield.
oh yeah, we did go to Springfield for it was like to deal with like the opioid like epidemic. We worked with nursing students, respiratory students. There was a lot of them there. Was there med students?
I think there were, but not as many. Like
Right,
my group
yeah.
was basically nursing and pharmacy.
Yeah, we went to a hospital up in Springfield and had to deal with like patient cases on the opioid epidemic and like how each role was part of that. Essentially, it was kind of cool, just like working together with everyone there. And then I think there was one more thing we were supposed to do where like something went wrong with like a family member or something, and like they had actors come in actually from SIUE from like the theater department and played like angry, sad, or like normal patients for us, and we had to figure out how to deal with like their death or a loss or something was wrong with their medication. I don't think we did that.
We're working with Dr. Kerr, but
Oh yeah, we missed it.
You had to tell the family that you messed up.
Yeah.
Essentially what happened.
Yeah. So that was, imagine, was a hard exercise that we didn't get to do, but it happens. Like it does. Like I've definitely had to do that already.
And all of that was new for our year or was becoming new programs. So I think SIU is working really hard to make more opportunities for that.
Mm-hmm.
I don't know the full extent, but I know they were trying really hard.
Yeah. But I don't remember any other time that we worked with other like health disciplines while we were in school. But there was a lot of times. Can you think of any, Sarah?
Everything else was APPs that I worked with disciplines.
That's fair. Yeah.
So sorry, that's the sum of it, but
yeah.
All right. We'll have an easy question now because I know that was a hard question. This one's from Joy Park Soo Young from Red Velvet. She's asking, my SIUE pharmacy shirt is fading. How can I get a new one, Jasmine?
Hit up SSHP because they're the ones who sell all the SIUE pharmacy shirts. There's our sister. Get one of those shirts if you're in pharmacy school. They're pretty comfy. I'm pretty sure all majors have one though. I've seen engineering ones and nursing ones. They're pretty nice.
When can I get a new one? Are they still selling it? Are the School of Pharmacy still selling them so I can get a new one?
That's like their biggest fundraiser, so I'd imagine. Yes.
No. Wasn't Paris the one that was in charge of it?
Like 2 years ago.
Oh. So who should I ask? Stephanie?
All right, next question.
I muted Jansen, so it's fine. I have a photo of all of our family dressed in SIUE pharmacy gear, so I'm gonna find that while the next question is being asked. But another question we have is this one. Does the School of Pharmacy encourage and prepare students to work in non-traditional pharmacy roles?
I think they try. I think they could do a better job. In all honesty, it's one of the things, not complaint, but basically a complaint. I love SIUE, but I think in talking to, now that I'm in Minnesota, talking to other schools, I think a lot of schools struggle with this in general, that the pharmacy field is progressing into a lot of different venues and the schools haven't caught up to that. We do have opportunities, like there's a compounding pharmacy class. There was one class we did our P1 year where we talked about all the different options. Yeah, I don't remember which class it was, but I know it happened. And there was one point where I know a gal from some company came and talked about what it's like to be on the big pharma side. And then you have your management classes where they talk about pharmacy management. Beyond that, I'm sure the opportunities are out there. I know there's new clubs that were forming when we were leaving for specialty pharmacy programs. But yeah, that's one of the bigger complaints, is it was very heavy residency. And then there was also community. And then they're like, there's also these options, but we don't really have a whole lot of resources for. So just be aware.
Yeah.
But if you have a really strong interest in it and you tell a faculty member that you're interested in it, they will have some connection and can do whatever you need to talk to whoever. I mean, at one point I thought I wanted to do Air Force pharmacy, and even talk to an Air Force pharmacist, and it was kind of outside of pharmacy school. But if you have the interest, just let someone know and they'll provide you the resources. So
Yeah, definitely. They're very open. Like Sarah and I will always just like walk upstairs in like the admin office and we'll start a conversation with like a faculty. It's so easy. Like don't ever be intimidated to talk to them. They want to hear your ideas, and like how to like forever change the pharmacy school program in the future. Like I'm sure they're still working on it. Um, yeah, non-traditional pharmacy roles, like Sarah said, we had like a compounding class, but like eventually our professor was just like, you'll have to like specialize that in the future. And we're like, oh yeah, okay. Um, and that's why it is kind of cool. Like we didn't have, I feel like, too like diverse of what is it, the advanced experiential experiences. Like we had a lot of like global ones, which was just kind of cool. But non-traditional sense, there was but the nuclear pharmacy was kind of different for some people, and a lot of our friends got to do it. But I feel like they weren't able to do too many things with that rotation. So yeah, definitely if you want to be in that non-traditional role, try to do some like research in it and see like if you can find someone maybe in that role that is willing to like tell you more about it and give you firsthand experience.
All right, cool. Yes, you. Anyways, I put the pharmacy photo of all of us in the pharmacy shirt if you guys want to see it. It's a good photo, yeah. Um, but Greg has a question that he wants to ask out loud to you guys. So, Greg, take it away, sir.
My question is, because I've heard people's different like opinions on it. Do you recommend working during like pharmacy school? Like, because I know like some people do, but you don't have to. But is it worth the experience, even if like your grades like damper a little bit because you don't have as much study time?
So I didn't work my whole first year of pharmacy school. And it was weird because I'd always had a job since sophomore year of high school. Um, I think it kind of helped me during my first year just to like get settled into pharmacy school. But I knew plenty of people work, like Sarah worked during pharmacy or like all through pharmacy school. But I don't know, I think it helped me a lot. I kind of missed working during it, but it was also kind of nice having that free time to study. But like it was after my first year of pharmacy school that summer, I got a job with Schnucks Pharmacy, and like we had only had 1 year of pharmacy school, so I didn't know too many things, and it was kind of overwhelming. But eventually you learn because like that's what you want to do in the future. It's like no pharmacy. Um, I don't think it hurt my grades too much because a lot of my bosses really they're lenient towards students. Like if they know you're in school, they know you need to study because they went through school also. And they'll work with your schedule. Like I used to work, it was just like 1 day a week, and then sometime like maybe 1 day on the weekend, or like I worked every Sunday, or just sometime on the weekend was like when most students work anyway, or they would help close at the end of the night if they had time during the day, if they didn't have an exam like the next day or something like that. So working was definitely doable during school. Sometimes I feel like it was like a struggle, but like you get through it, and it can be a good experience. I think we've had classmates who didn't work the entire time during pharmacy school. I feel like it kind of helped them like in school wise, but it didn't really help them like trying to find a job because you're also networking, building, like knowing not just your boss but like the supervisors like above your boss's boss, so like they know who you are in case you want a job with them in the future. So it's a balance, I think, with work and school for sure.
Yeah, I would say do as much as you can handle. I mean, obviously, we had, I can think of specifically one student who worked way too much, but she could, like, she financially needed to. And I think her grades really hurt because of it. And that's super unfortunate. But she's also like an amazing pharmacist now, like, also working a ton. So I go back and forth on it because me personally, I was really fortunate. I got to work in an independent setting, and then I also worked in a hospital setting. So I had a clearer picture of what I wanted to do and a lot of diverse experience to talk about in interviews. And I also used my boss for residency interviews. I found it tremendously invaluable. I really loved the time I spent at work, and sometimes it was nice to go and not study, even though, I don't know, work can be, some days are great and some days are not. But I also was fortunate that my bosses were, like Jasmine said, if I couldn't come in, I could just trade my shift with someone else. And a lot of times there's quite a few students, and sometimes they're from still cop so that they don't have the same exams as you. So you can kind of coordinate with that. Um, I would say if you can't handle it for the first couple of years, I would at least try to get 1 year of working because, like Jasmine said, I think those of us in our class who did not work at all like had a really hard time. Now, some people got residencies just fine, and that's fine. And um, but I think it helped. Like it kind of goes into that networking thing too. So I would recommend it, but obviously there's circumstances where people can't. So that's my political answer on it.
All right. So we have 3 questions left. If you guys still want to add more, you probably squeeze it. Minutes. You guys are doing great. The YouTube's gonna be so good. Jansen, please make a YouTube poop about this. I would laugh really hard if you do that. But here is the next question. There we go. So this is about the honors program. I think Jasmine was in the honors program. Sarah, I don't know if you were too as well. Cool. So make sure you guys answer honestly, okay? Okay. If either of them were in honors, how did being in the honors program help with pharmacy school and after graduation?
Sarah and I took 2 honors classes. Are you talking about the one in undergrad? Right, Justin? Okay, yeah, we took 2. We took the same ones, right, Sarah? Right, okay. Our first one, I felt like it was just like a writing class, to be honest. I didn't get much from it. I don't know if Sarah had a different experience, this is like freshman year, and I didn't really know what was going on at the time. Like I was in Orgo, so I was struggling with that too. But I don't feel like my first one was all that great, to be honest. Sorry to the honors program. It was kind of like because we were in SEP program too, so we had to like also be part of the honors program. I don't know if it's changed for you guys in the undergrad. Okay, yeah, I don't know how many classes you have to take, but we only took 2. And how many do you have to take, Gregory? I heard something.
I think it's 4 now.
4? Oh, thank oh God.
I think that increased like right after us, because I
Okay.
remember hearing about it.
I think
Really?
Matthew can confirm, but I think it's 4.
Oh wow. Yeah, no, we only did.
Oh, okay,
6.
6. I can't count.
That's a lot more than 4. Yeah, we only did 2. Our second one though, that was pretty cool because it was with one of our professors. So like that was kind of neat. It was with Dr. Hecht, and I know Justin's in that class actually right now. Yeah, you too. Yeah, Dr. Keith Hecht. It was what is it called? Pain and suffering, I think. Yeah, it was pain and suffering. So that's cool. They got to implement pharmacy also in it, which like made sense because Dr. Hecht's like an oncology, so cancer pharmacist. So he made us like go out to the pharmacy and look at medication. So that was kind of nice. I don't know if it like totally helped with pharmacy school too much. I mean, a lot of us were honor students, I feel like in high school, so like it wasn't anything too different, but I don't know if it totally helped me in pharmacy school. I felt the same regardless. I don't know, I'm being honest. Like, Sarah, you can go now.
So after, was it forgiveness? Was that their first one?
I think it was forgiveness.
I got asked to change my major to what was it, like a philanthropy or like what, philosophy something. Yeah, like got a formal email to change my major, and that was not going to happen. But
Sarah's so good at writing.
so it really increased my critical thinking and my writing skills that I use every day in pharmacy. But no, I don't know. The first one I agree, we probably didn't get too much from, but I really liked the one with Dr. Hecht, and I don't know if I use it so much now, but at the time I felt like there was certain activities we did that I took benefit from. It's been a long time, so it's nothing against them that I don't remember it. I don't remember some of our classes in pharmacy school, so I'm sure it benefited somehow, and we're probably better people for doing it, but
Probably. I think you hit the mark there with like the critical thinking component of it. Yeah, that's really it. Higher thinking and just like being mindful, essentially. Yeah, that's really it I can think of.
That's true. This is right before I think it was right after Jasmine's. Wait, were you the same year as Adam? That Adam guy, Adam? Oh, you were here, you were below you. Okay, just kidding. So 2 years after Jasmine and Sarah graduated, well, started 2 years after they started. That's when we had the honor switch, and that's where the courses changed. And then I remember Anna No's class. I should have asked Anna No to come here today. Oh well. Anna No's class asked for to reduce it. I know he had to do all of the honors classes. I just to do 6. But anyways, that was a question one of you guys had. I have 2 more questions. So here's the next question. Okay, so my least favorite class is organic chemistry. With that being said, will I struggle a lot if I'm not strong in it? I think struggling a lot in pharmacy school.
honest answer, yes. Will you make it? Yes, because I really struggled really badly. You won't fail, but you will struggle badly. At least we had our first year classes that were really focused on organic chem, and those like really hurt my GPA starting out. After that, when you get to therapeutics, it's like thrown in with other stuff. So you're like, okay, well, if I miss all of the organic questions, but I get everything else right, I can still pass these. It's kind of the mindset. And we're not the only ones. I know people who are really good at organic chem that are like, I have no idea. It's just tough. And I can say, of all the pharmacists I've ever met, I think it's a general consensus that it's just something you have to get through. I can't say I've ever used it post graduation, but someone out there feels really passionate about it. So
Yeah, Dr. Miller. Dr. Miller does. She was my orgo teacher. I loved her though. She was great. Justin was not my SI leader, obviously, but my SI leader actually, she was in the year above us in pharmacy school, and she knew orgo like back and forth. I don't know how she did it, but yeah, it was definitely not my strong suit either. I don't think any like healthcare person that I knew who went to SIU undergrad really knew orgo either. Like I knew medical, like med students, I knew nurses like who took it, and they're just like, nope. And I'm like, yeah, same. But yeah, like Sarah said, like your first year, it's a lot of like, how does a drug work at specific points or receptors in your body? And sweet old professor who taught that to us, it was so hard. He's so smart. But Dr. Kreider, if he's still there when you guys are there. Look, Sarah's getting like very emotional right now.
I love him.
He's so nice.
But
He
he's
offers
so
so much extra
sweet.
credit because he knows we are good at that class. But like that was our first class, and I remember almost failing that exam, to be honest. It was like our first exam in pharmacy school, and I almost failed it because of that. But like graduated, like clearly like I'm still here. Justin, if they're all your students, that's not fair.
What now?
Justin,
Okay, but my SI leader was in my pharmacy class and is not good in school, so
he is not.
I was screwed. But if you do understand it, like the one exam we did understand orgo, it kind of helps like understanding the drugs. So if you can, you're set, and then you'll lose it after graduation. But
that was Dr. Heck's class too, right? For oncology. We knew that we actually like took time to actually study it because we knew it was going to be the first exam, and like we can't bomb it. It was like the new year and everything, and we're like gotta study it. Like it started to make sense, I feel like, a little bit after that, but then I don't remember any of it. So definitely use your friends who are very good at, we had 2 people in our class actually held a session in one of the classrooms to teach us orgo and like the medicinal chemistry behind the drugs. So if your class was like as collaborative as our class was, you guys will have a good class, to be honest. Because our
relationships, circling it back.
Yeah, they're like the smartest kids in our class, and they taught all of us. So
Sorry, I was DMing. So we have 5 minutes. Yay! We have 5 minutes left. So I don't know if I want to do that one question or I want to end it on a good note. You know what? We'll end it on a scary note. That's what we'll do. Here you go. Have you ever dealt with any dangerous / scary situations in the pharmacy setting?
just a note, I think Michelle asked a question earlier, Justin, in the chat. I just wanted to let you know that also.
I know Michelle did.
What?
I know Michelle.
Oh, okay.
Okay.
I was just making sure you saw that question. Whatever. Do you still want us to answer?
Michelle says, do you want to answer this question or Michelle's question? I don't care.
You can answer both. It's not Sarah's bedtime yet.
Getting close.
Getting close.
There's Michelle with Matthew right now.
Oh, hello, Michelle.
Psychology. Anyways, let's go with, have you ever dealt with any dangerous, scary situations in the pharmacy setting? No, we have one more question, and that'll probably be it because it's almost 8 p.m.
Dangerous or
So-
scary situations. I mean, I worked in 2 pharmacies that are not the best areas, and I tell Sarah about it all the time. It's kind of, I mean, I'm in St. Louis. It doesn't make the pharmacy or like anyone like there like less significant. Like it's still a good pharmacy. It's just the area can be kind of sketchy, I feel like. And the customers you do see, they're all very diverse. They're all very interesting to deal with. So we learned a lot how to interact with different types of patients in pharmacy school, I think. So that like kind of helped. And then just like having experience while you're working during school, you're exposed to that already. So you're not, it's not a culture shock, I guess, when you get into the real world. I do know though that I didn't get to deal with it, but so like what my store is giving out COVID vaccines right now. And so is another CVS inside of Schnucks. I heard recently they had someone kind of pass out from getting the vaccine. So they actually had to call 911. And I never experienced anything like that in my pharmacy. Like health wise and like having to call 911 or doing CPR. Like we're all CPR certified. Like I've never used CPR or anything like that. But like that's why we're trained to do that, learn how to use an EpiPen if someone is having an allergic reaction. And I think they use it also at that other situation. Other than that, just some dangers and like situations I dealt with was like kind of like domestic violence, I feel like, because sometimes families come up to the pharmacy and the pharmacist, this is when I was a student, the pharmacist had to kind of like report it though, because like there was a child involved and like husband and a wife. So you do see some real things while you're out in the pharmacy that they don't teach you in school how to deal with too well. But it's definitely all about experience, I think. Is the best way that I can put it. But and it helped me not be too shocked, I feel like, being a pharmacist now. So it helps though.
Well, nothing immediately came to mind, which I guess is a good thing. The scariest thing for me is honestly watching patients pass in a code. So, and you can see that with any profession, well, not any profession, but most of you could see that. I saw it as a student, was my first one. So that's the scariest I've had. Otherwise, it's all good catch pharmacist stuff that could be scary if I didn't catch it, but I've been fortunate enough not to have a bad situation. So
A short question we can answer for the last question is, how rich are you?
Jasmine's way more rich than me.
What did you say, sir?
I said Jasmine's probably way more rich than me. Well, I don't know, maybe, but I like to think not very.
I think it's gonna help me pay for loans, which is where a lot of my money is gonna be going towards. But I mean, residents have to take like a pay cut though, right,
A
Sarah?
massive pay cut, and you're salaried, so they work you like a dog. I work from 7 to 11 this Friday. I'm not looking forward to it. No extra
Oh.
pay.
Poor Sarah.
That's okay. It's almost over. Just a few more months.
Yay.
For reference, for reference to the answer perspective, every time I visit Jasmine, she usually buys me food. So there
Wait, what did you
go.
say?
For reference to the question or the answer is, every time I visit Jasmine, she always buys me food. So yeah.
I still don't know
Thank
what you said, Justin.
You buy me food every time you see me.
I buy food for my technicians, so don't be special.
Could you try again?
Sorry, that was my watch. That was funny. I was gonna say something. Oh yeah, last Tuesday I was at Jasmine's house because I died from the COVID vaccine. That was really funny. Thanks, Jasmine and Jansen. She was there too.
Hi, Birdie
Let's
from the
see.
pharmacy talked to us.
So the last question is, have either of you ever had to personally deal with patients doctor shopping? What does that look like? And this was from Michelle. So
I have not. I can say that. I've dealt with people who I thought were trying to make meth.
What?
Yeah, daubers.
What
We had to
happened?
say because they were trying to get too much of the ingredients for it. We said no, and then life went on.
We said no.
That's as exciting as it got in small town Muscuda.
I do see it. We have programs that kind of alert, like if they're filling like a controlled substance, like an opioid or a narcotic or whatever they're filling. Some states have like programs that show you like how many, like when they filled it, how many days they got of that prescription. Like some pharmacies will only fill like 2 days early or like day of because they know how their patients can be. And like we don't want them to like get addicted to these medications because it is really dangerous. We all learned that. So, but like we have a program that like says like expect suspected patient or suspected doctor shopping, I think is what it's called, like in red letters. So that kind of helps so we can see which doctors they got it from, because some doctors don't even know like who's prescribing what sometimes. And I've run into that actually a lot. I've had to call doctors and be like, do you want me to like delete this prescription because they have it coming from somebody else, or like who, like what do you want? And like there's some profiles that are kind of scary. Like you see them on like 2 different types of opioid controlled pain medications, but you also see them on something like Xanax that interacts like really badly with those medications, or they're just like on so many. But like sometimes doctors let that happen, and that we like personally we have to like not accept some doctors' prescriptions actually, like company wide, just because it got so bad. And yeah, patients will who unfortunately can be addicted to these medications will doctor shop a lot, and you do see that, and we make note of that, and we inform other pharmacies so that they're known. Like Walgreens, like they told me one time, and like we communicated that way just to make sure like we weren't dispensing something that someone probably shouldn't have. So it can get pretty serious with doctor shopping.
that was a good question, Michelle. Oh, I mean, let me look at the camera, Michelle. Sorry, we're not in the same room or anything. But yeah, I mean, that was all the questions I had today. So can everyone give a round of applause to the panelists today? They did so good. Yeah. Yes, thank you guys for taking time out of your busy schedule to be here. Can we all get a thank you in the chat too? Yay! But yeah, thank you, Sarah and Jasmine, for coming here today. Before we head out, I just want to remind everyone we're going to have a general assembly over here. Actually, yeah, a hybrid general assembly on Wednesday at 8 p.m. I'm going to put the sign up link at noon, 12 p.m. at noon on Tuesday. So we can only have a max of 20 people. So if you want to be there for it, come here or sign up in the sign up Genius. Also, Wednesday afternoon, 12 p.m. to 2 p.m., we're having an unofficial P-Hub picnic outside the Cougar statue. Gonna be spaced out. It's gonna be great. I'm bringing a special guest too, that you guys will find out. Ooh, I wonder who the special guest is gonna be. But yeah, before we go, Jasmine, Sarah, give me one sentence answer of just one piece of advice for any healthcare. The picnic, Gregory, is this Wednesday at 12 p.m. Not. I think he has lab or something or class. It's from 12 to 2. Anyways, Jasmine, Sarah, give us a sentence giving us your best advice for any pre-healthcare student that I will post on the Instagram.
Pressure's on, Sarah.
Like, how do I fit my soapbox into one
I know,
sentence?
right?
Get involved and know your professors. Network, network, network. That's probably not a sentence, but that's my advice. Thanks for having us. Thanks for listening. Really enjoyed talking to you guys about our experiences and hope you took something from it.
I guess my advice would be try as hard as you can and ask questions. You're not going to know everything. Like, that's probably the biggest advice I can give. Try and ask questions because you're not going to know everything and they don't expect you to know everything. I've learned that multiple times. Even when I doubted myself, I had to remind myself, try and ask questions because they want to help you. But like Sarah said, this was a lot of fun reliving pharmacy school again. Thank you for not asking about our classes because who don't remember too much of that. But this was a lot of fun. Thank you, Justin, for organizing this. And thank you guys all for your questions. They were really great. If you have any questions, definitely just reach out to Justin. I'm sure we'd be glad to answer them for you.
Alrighty, everybody. That was the pre-farm Q&A. Woohoo! That was a loud ass clap. Oh my gosh. But yeah, we're all free to go. I would say inspiring. So thank you, everybody. Please find the recording on YouTube on the Pre Hub channel. But yeah, see everybody later. Bye.